just accept it.
I rise very briefly to support very strongly Amendment 80, 81 and others in the group, which have already been so eloquently explained, so I will not repeat those arguments. I declare an interest as an Honorary Fellow of the Royal College of Speech and Language Therapists, and we've already heard the importance of them as a profession, as part of the wider allied health professionals. And it is always worth remembering that allied health professionals make up a third of the total workforce. Yeah. And responding on workforce planning in committee, the Minister stated, we share Baroness Finlay, who we've just heard from, view of the importance of integrated workforce planning across NHS and non-NHS employers, and work is underway to achieve it. But unfortunately at that time the Minister did not set out what that work was, and the response didn't really give a great deal of hope to the long-term failings in workforce planning for allied health professionals in general and speech and language therapists in particular. And we need to ensure that that is addressed. And I believe, as we've heard, these amendments do properly address the issue. And I draw particular attention to Section 4 of Amendment 80, where, as we've heard, it clearly states that Royal Colleges must be consulted in drawing up the report that will be laid before Parliament on meeting the workforce needs of the health, social care and public health services in England. By that consultation, we should ensure that allied health professionals, and particularly speech and language therapists, who work sometimes directly in the NHS, but often in other health settings, and can be employed in those other settings by the NHS, but working in settings such as education, such as the criminal justice system, and other parts of the social care system, or work in independent practice. And they all should form part of the consultation to ensure that the plans that come forward on workforce planning are comprehensive in their nature and comprehensive in their coverage. Therefore, I believe that these amendments are crucial to achieving that objective, and I'm sure the Minister will want to give us that same assurance when he responds.